Kentucky Attorney General is suing the governor.
I like it.
Law of lesser magistrates.
That's why he's there.
More of that.
Do you get your health advice from a tranny? Would you do that?
I'm sorry to say what?
Yeah. And undercover cops came in and busted a hair salon.
Yeah.
Were they selling drugs?
Yeah.
No, they were doing nails. Hey, y'all, welcome to Cross Politics on the Fight Laugh Feast Network. Pastor Toby, Chalk Knox, I'm the water boy. What?
Oh, man.
Play it again.
What's wrong with you people?
Oh, man. Guys, Knox County is going insane.
Where's Knox County at?
Knox County is in Tennessee.
Okay.
They're
real America.
The health director is saying that you can't take communion, and instead they should consider guiding parishioners in how to connect with the spiritual aspects of these practices during this phase.
Can they go to Walmart?
And it's actually, and communion, just so you know, is not a core part of Christian worship, according to the health director of Knox County.
Wow.
Who anointed him the leading pastor?
That's a woman.
Oh.
Ouch.
Yeah. That's why you never listen to a woman preacher. Even if she's a director of a health district.
I can't believe we just
Yeah, I mean, that's how you get trannies running this.
Yeah, well, we're going to get
Right?
there. We're going to get there. I just don't feel right about this whole show. I'm just saying, I'm letting my feelings out right now.
I'm feeling some type of way too.
I don't feel good about what's going on in Idaho. I don't feel good about what Trump did yesterday.
Really?
We're going to get to all that.
You're just upset at everybody.
Yeah, my soul, my spirit is not right within me.
Okay.
So before we get there real quick, here's some upcoming events that we're going to be at real quick.
First.
We got Grace Agenda coming in August. Everyone sign up for that.
Yep.
Come to Moscow,
It's
Idaho.
free.
It's free. It's Grace. It's free. We'll be there. Uncle Gary will be there. Pastor Wilson will be speaking. Of course, Pastor Toby's speaking.
School of Practical Christianity.
It's going to be fantastic.
Back to the basics.
Great time.
We need that right now.
And we'll do a little cross-politic event somewhere in between all the madness.
Maybe a
somewhere.
Sabbath feast or a psalm sing.
Something like that. Yeah, well, it'll be.
That sounds good.
It'll be a lot of fun. And then we're going to be at our own Fight Laugh Feast conference, our first annual Fight Laugh Feast conference in Nashville, Tennessee, October 1st through 3rd. Club members, you guys get $100 off. So email me for your discount code for that, club members. That lineup is fantastic. You guys got to go to fightlaughfeast.com, look at the lineup, look at the schedule. We'll see you there in October. We're going to come out of this strong. I'm excited to be there in October. And then lastly, we're going to be at Right Response Ministries first annual conference also in San Diego.
Yeah,
that's nice.
That's going to be fire.
That's going to be fun.
Virgil and Daryl from Just Thinking
Just
Podcast.
Thinking Boys.
Yeah, it's going to be rowdy over there.
Yeah. So download their app, get connected with Right Response Ministries already, and we'll see you guys in San Diego.
Also, download the Fight Laugh Feast app.
Yes.
Just by the way. I mean, if you haven't downloaded it yet, I mean, what's wrong with you people?
It's the only place to get. I like what you say at the end of it. Are you listening to the daily news briefs, by the way? Those things are phenomenal. I mean, it's just so helpful to get caught up real quick every morning with a daily news brief.
Every day.
Every day.
Every day that we remember.
Just get it. But it's the only way.
Every day that we feel like it.
The best worldview baseball
days.
podcast
In the world.
in the bullpen with Mark Dewey. You
Isn't
have to
that-
listen to
So
it.
my boy from ADF texted me on Monday,
Yeah.
and he said, "Man, I listened to Mark Dewey on Cross Politic last week, and I never download apps.
Yeah.
I never download apps.
I had to do it this
So
time.
me and my boys, we downloaded their app to catch Mark Dewey.
In the bullpen. In the bullpen.
People from ADF are downloading our app.
Do you
How
have
about
his intro
that?
music?
I don't have it on
Oh,
here.
Yeah.
man. Just listen to that first intro and you're hooked.
Yeah,
Yeah.
He's killing.
Hooked.
He's killing.
Oh, man. One Hat Technologies is a software development company. It's not a hat company.
But they have hats.
but they
though.
do have
They still have
hats.
hats.
But we have a hat.
Right here.
Their motto is software craftsmanship to the glory of God.
I love that.
One Hat builds custom apps of all kinds, business apps, mobile apps, web apps, desktop apps, even apps for smart home devices. So that they can spy on you. So if you're in the market to have a new app developed, you should definitely check out one. Well, I can't say that.
You can't.
No,
Don't
you
tell. You
I
can't
didn't say
tell
that.
them.
You can't tell nobody to check it out.
I can't tell you to do anything.
But is there a website?
We cannot tell them to
But
go
if
to
I-
One Hat Technologies. What they can't go to where?
No, that's
they
illegal.
can't go to where?
It's I'm just going to say a website, and you can do whatever you want with it.
Okay.
onehat.com/cross-politics.
Now, I might
Yeah.
go there.
onehat.com/cross-politics.
Oh, okay.
Yeah,
All right.
that's all I'm going to say.
Message.
During a news conference this afternoon, Attorney General Daniel Cameron is striking a new tone with Governor Andy Beshear, one that hasn't been publicly heard, but one that surrounds the Constitution.
These seem overbroad in my judgment as it relates to the travel ban and the way that the church restriction has been applied.
The Attorney General demanding the governor allow churches to have the option to hold in-person services, also joining in a lawsuit filed against the governor weeks ago by a Northern Kentucky woman. That lawsuit over the statewide travel ban. Both topics, the Attorney General says, have been overstepped.
I'm hopeful that he will recognize the importance of our First Amendment and constitutional rights.
I like that.
If not, then we will be prepared to move to the next step of filing a lawsuit to protect.
Can I just say here that the reason why there's tension here is because the government in this whole crisis is basically claiming sovereignty.
Yeah.
Yeah,
Like,
absolutely.
Like not even constitutional sovereignty.
Yeah.
They're just claiming.
No.
Yeah, they're telling you can't have communion.
Yeah. You can't have communion.
Yeah.
We're
Close to
king.
sovereignty.
No,
Yeah.
this is the nanny state. I mean,
Yeah.
this is the thing we've been talking about. Like, it's and I don't mean this as an overstatement. It really is nearly totalitarian.
Yeah, it's getting there.
It's like
It's entry.
and by that it means like we can touch anything we want to.
Right.
That's
I'm not
right.
saying they actually have done that yet.
Right.
I mean,
Yeah.
most of us are still able to.
They still let Walmart open.
You can still go to Walmart. You
Yeah.
can still go get your cup of coffee.
Go get your liquor.
That's because Walmart worships at the altar.
Well, they're.
You know.
But they've demonstrated though that they don't actually think there's anything off limits.
Yeah.
You know, the reason that churches are so important in this is because they're actually one of the few that are going to stand up for the Constitution.
Absolutely.
They're an institution that is a pillar
Right.
against their overreach.
Right.
But if churches haven't been discipling their people on even how to understand the Constitution, they can't stand up.
Right. That's absolutely true.
Well, Dr. Levine told me there is now a focus on three things mainly. Widespread testing for anyone who wants it, she said, getting adequate medical
good.
supplies, and making
Widespread
arrangements
testing.
for a surge capacity of patients. For that, they're waiving regulations covering hospital beds.
We're discussing this. They might be able to add beds, how to add ICU beds, and then in particular the equipment that
What's
we have
his
been
real
discussing.
name?
So all of those conversations are happening as we speak, as we prepare.
Dr. Rachel Levine, the
Stop
Secretary
it.
of Health in Pennsylvania,
Stop.
told me in a
Stop
one
it. Make it stop.
I can't go on. I can't go on. My slide is stuck.
Please. That's a dude.
That's a dude, and he is the director.
And if you're listening to this, it's a
Yeah.
dude in a dress.
And he's the director of
is a
the
dude-
Department of Health and Welfare in Pennsylvania.
He is the director of health and welfare of Pennsylvania.
That is unbelievable.
Pennsylvania.
And these,
Girl, you in trouble.
boy, you mean boy? You in trouble?
No,
Okay.
he's talking to Pennsylvania.
Okay.
What?
No, but listen. I mean, look at this.
Who did this?
You got this is the insanity.
Yeah.
This is the
Yeah, that's
insanity
right.
that we are in.
Yep.
You got a cross-dressing dude,
Yep.
and worse than that, maybe I don't know what kind of drugs he's taking.
Who wants you to call him Rachel?
Who doesn't know who he is, doesn't know who God made him, doesn't understand basic biology, and he's in charge of health
Yep.
in Pennsylvania.
And the COVID response.
Yeah. This is a metaphor for the whole deal. Who's running all of this?
That is right. That is exactly right.
Trannies, right?
Yeah.
Which
America! What's wrong with you people?
if you don't know what a boy is and what a girl is, you
Yeah.
should not be trusted with anything. With anything, right? There's not.
This is why my soul this is why my soul just doesn't feel right. Is because
no, but this is who's running the show.
exactly
Right.
But we also have here in Idaho them making the same measures and precautions or whatever that Pennsylvania's doing.
Absolutely.
We're supposedly conservative, and whatever happened to conservatives in the belief they used to trumpet this at some level that hey, we want we think you the individual can make the best health decisions for yourself.
Right.
And we don't do that.
Right.
We slipped into this totalitarian situation, and I think moving forward, if Christians
But that's the
don't
thing is-
start exercising certain muscles right now,
Yeah.
then moving forward, it's going to there's problems.
No, I think it's actually gone.
What do you mean?
I-
that muscle?
Yeah, the muscle's gone.
Yeah.
I think I think it's gone.
Wow.
I think what we have right now are some it's like when the corpse is already gone, but it's still it kind of wiggles a little bit.
Yeah.
You know, the kids they fall down dead and then they shake. And
Yeah.
That's what's going on right now.
Wow.
Okay, that's what's left of the conservative Christian church.
Right.
It's dead. It's gone.
Yeah.
The fact that all of it, but it's been happening for decades.
Yeah.
And
this you knew that this muscle was dead when Roe versus Wade was passed.
Yeah, right.
And all the states were like, yeah, I guess that's what we got to do.
Yeah. Yeah. Romans 13.
I guess
Romans 13.
I guess we got to let them murder the babies.
Yeah.
And then Obergefell just a few years ago.
Yeah.
Dudes can marry dudes.
Romans 13.
And everybody's like, There was one crazy lady in Kentucky that was like, I'm not going to do it.
Yeah, yeah.
Right? That was it.
That's right.
That was it. But here's the thing. The whole tranny thing is totalitarian.
Yeah.
Okay.
Absolutely.
The whole instinct is to say, I will be God.
Yeah.
Yeah.
I am God. I will be God. And so that means you remake the world in your own image.
And I demand that you recognize me as a woman.
And it's inherently violent.
Yep.
And so what that dude is doing is he is defacing the image of God on himself.
Yep.
Yeah.
That's right.
And at the same time is completely dishonoring every woman in the world.
Yeah, that's right.
You are not a woman.
Where's the feminist movement at right now?
Yeah.
In Pennsylvania.
Right.
Yeah.
I don't believe you. Another thing too is I know there are a few people that were probably watching, and our response probably caught them off guard. And if you saw this and you didn't do what we did and had that knee-jerk reaction internally, then you're the one who got.
Yeah.
They got you.
What do you call it? Desensitized.
You've been desensitized so much so that this is normal for you to see.
Right.
Absolutely.
You've been desensitized so much that now whatever they want to bring in, you're comfortable with.
Yeah.
And they got you. I think Vodi Bakum talked about this in Gay is Not the New Black.
Yeah. Right.
Desensitized, jamming, and conversion.
Yep.
And by now, if you didn't have that reaction, and you don't have that reaction, you've been desensitized and you're on the way down to conversion.
And you've been jammed.
You've been jammed.
And you're nearly
well, jamming.
converted.
This is a jamming process. Before you move on, this is a jamming process so that they desensitize you to the trans.
Right.
And then the jamming process is they put it with health.
Yeah.
Right? They put it with the science. They put it with the health.
I mean, you don't want people to die.
That's right.
You don't want people to die.
That's right.
You just want people to die. That's it. Right?
Yeah.
And that's the jamming
And that's
process.
the jamming
You're
process.
Well,
how do I respond to that?
I don't want people to die.
Yeah.
But you want people. I mean, that man.
Yeah.
Yep.
He is the death of humanity.
Yeah.
Right.
I mean, that is suicide.
That's right. No wonder why we can't tell what a.
but when you let this proliferate, you are asking for. You're asking for this, and there's no brakes on this insanity.
No,
you can't say dudes can be girls and girls can be dudes and dudes can marry dudes and you can murder babies and then somehow have anything reasonable to say.
Yeah.
Yeah.
Well, Dr.
Oops, sorry.
No, that's good.
So I'm actually embarrassed for Pennsylvania. But I'm more embarrassed for what happened here in Texas.
This woman says she's preparing to break the law. Shelley Luther is vowing to open up her beauty salon in Dallas at 9 a.m. tomorrow, despite the state of Texas ordering all non-essential businesses to remain closed.
Why are you opening your salon?
I'm behind on my mortgage. I know that a lot of my stylists haven't paid their mortgage payment. It's either come in and make money to be able to feed your families, or sit at home and freak out.
Have you had moments where you feel guilty? Maybe this opening of the salon could
Jamming.
actually spread the virus.
You feel guilty?
I don't want anyone to get sick, and I don't want the virus to spread. It will be one of the safer places for people to go instead of going to Walmart or Home Depot.
Since news broke that she's defying the order, the small business owner and mom of 3 says her phone has been ringing off the hook with people who want their hair done.
How concerned are you that you're going to open and the police are going to come?
I'm prepared to, take on that if it does happen. I hope it doesn't.
The state of Texas tells Inside Edition if we receive a formal complaint, we will open a case that will be investigated.
Notice how they say
there
that.
There are 19 stylists who work at Salon a la Mode. Luther says they need to get back to work immediately. Luther says she'll have strict precautions in place for both workers and clients.
Notice how they say if we receive a formal complaint. So they're not. It doesn't sound like they're actively going out to do it, except for even the detective
in Laredo, Texas.
The Laredo, Texas.
Dude, Texas is going.
This is where I'm embarrassed. This is where I'm embarrassed.
What is wrong with Texas?
Man.
Right? Did you see what they did?
Yeah. So 2 undercover police officers, detectives.
Yes, posing as customers.
Yes.
Okay, these 2
What a shame.
cosmetologists do nails and eyelashes.
Yeah.
And
they're doing it out of their house right now.
In their house.
Yeah.
Get customers via social media.
Yeah.
Some people snitched on them. Told the PD.
Snitches.
Laredo PD had a couple of their officers,
private investigators,
pose as potential customers
with masks on.
Get them to agree to do it, and then bust them, arrests them.
Yep, and charged them. I don't know.
And charged them.
That's unbelievable. That's why I'm embarrassed in Texas. I thought this was interesting here. We had to one of our friends put this comparison together where it's comparing Sweden, who did not do a lockdown,
right,
in relationship to Michigan, obviously, who did a lockdown. And the reason why Sweden and Michigan are a decent comparison is because they have population size, similar population size,
they actually line up in a lot of ways.
Land mass size, similar density sizes, and so forth. And you see that Sweden, who never locked down, has about a little under 2,500 deaths, and Michigan, who's had some of the most draconian lockdowns. You can't even buy flower seeds at the store,
right?
Kind of lockdown,
because flower seeds spread coronavirus.
Yeah.
Actually, if you plant them,
it spreads freedom, and we can't have that.
and
they had over 3,670
1,000 more, 1,100 more deaths in Michigan. Yep. And one of the obvious questions that comes out of this sort of thing is wait. So, but what about population density? Size of the state. And you checked on this, Gabe, and actually the population density is really close.
Yeah, it's very, very similar. Yep.
And so, but here's the thing. You can't argue with trannies. Yeah. You can't reason with trannies. Yeah. Okay, they threw reasoning out the window.
That's right.
And you have trannies running the country.
Yeah.
Okay, yeah. I mean that's what you have.
And I think that issue right there is probably one of the things that's bothering me so much right now is that they have the narrative and you can't reason with them at all.
And here's the thing: in the beginning, it was all about the data.
Yeah. That's right.
The Imperial College study, the University of Washington study comes out, and everybody says, look at the models. It's kind of scary.
Even though the Imperial College was not peer reviewed.
Hold on.
I wanted to say that.
Boy, he just talked about jumping everybody.
But here's the thing. You guys saw Dr. Erickson, and what's the dude's name?
From the Kern County doctors.
Yeah, so they come out with they do the press release, and they say, hey, look at what the numbers we're seeing. And everybody suddenly becomes a data modeling specialist.
Yeah, right.
And we're like, but their thing was not peer reviewed.
Yep.
And it was not a random sampling. Yep. And the same thing happened with the Stanford study, also with the Florida studies. They're all saying these have not been peer reviewed. Guess what, guys? The Imperial College study has not been peer reviewed.
Yep, that's right.
And if everybody would have been acting like that from the jump, we probably would have a whole different setup.
So if that's the standard, then open everything back up until we have good information.
Preach it.
But right now, you have locked down the country, and you've completely thrown
30 million jobs.
Due process. 30 million unemployed now and counting, right? But this is Romans 1, guys. God has given us over to crazy.
Yep.
Right? You want trannies in the libraries?
Yep.
Here we go. More Cross Politic when we come back. Well, what a great place to end.
Americans have been traveling down the health insurance highway for decades. But lately, it's been taking us to places we don't want to go. For Christians, it's hard to know which road to take. Or is it? Samaritan Ministries provides a different direction, a biblical path for their members to pray for each other and share financially in each other's medical needs.
This idea that Samaritan has adopted from the book of Acts should permeate all parts of our lives, not just health sharing. We, as a body of believers, are living out New Testament Christianity. This is what God intended for the church.
Do you believe that you need an insurance company, or do you believe that God will provide your needs? And there are people that you've never met before who are going to pray for you and meet your needs. There's another way.
Looking for a new direction for your health care? Visit us online at SamaritanMinistries.org.
Logos Online School is your affordable partner in classical Christian homeschooling, offering live teacher-led instruction 4 days a week to students in grades 7 through 12. Our experienced, enthusiastic teachers provide instruction in math, science, literature, history, languages, Bible, apologetics, rhetoric, government, and economics. Find out why more and more Christian homeschoolers are turning to Logos Online School for the education of their children. Go to logosonlineschool.com today. Hey, look at this. Look at this shirt. What you got on? I got my Fight Laugh Feast t-shirt on.
Can we make some polos?
It feels good.
Or at least like something I could put Fight Laugh Feast right here.
Polo?
You got one. Didn't you get one?
Yeah, I need another one.
Hey, welcome back to Cross Politic on the Fight Laugh Feast Network.
Maybe a few different colors too.
Support Rowdy Christian Media.
Like this one.
And become a Fight Laugh Feast club member and get your very own t-shirt while supplies last. Hey, with us on the line right now, we got Dr. Mike Ratliff. He is a general surgeon in Houston in his 30th year of practice. He's married, has 4 kids.
They baptized, doctor? You baptized them kids?
Yes, sir.
Look
Yes,
at that.
sir.
Yes, sir. He's on it. He's on. Yes, sir.
He was ready.
I did it.
He's a member of St. David's Church there in Tumble, former elder at the church, originally from Fort Worth, Texas, board certified in general surgery, and a fellow of the American College of Surgeons.
Ooh.
Dr. Ratcliffe, thank you very much for joining us.
A pleasure. Thank you.
So, you're on the front lines. I know you're in surgery, but what's your take on the whole corona crazy, and particularly how the government has been handling it? And maybe as a follow-up, how would you have handled it if you had been president for the day?
Well, it changed things just upside down, as it has for so many people throughout the nation and the world. The hospitals, I think, and I'm glad to say my hospital included, responded pretty quickly about preparing for the worst, not really knowing if that quote unquote worst would happen in a large metroplex area like Houston.
Right.
And but things changed pretty suddenly. The work inflow diminished rapidly. There wasn't a whole lot to do. Supplies were short. People were panicked, and it changed the atmosphere of the hospital in general. I could just tell when work diminishes and there's not much to do, and yet people are on edge because of the contagion aspect and so on. It does change the atmosphere. It was sobering. I think what the government did initially, I think seemed appropriate to me. They were cautious. They were aggressive. Because it was the unknown, and that's what made this venture so difficult. I think is it was new, it was unknown. We didn't know really what to expect. What I have been glad to see is that the government, to a fairly extensive degree, has practiced federalism at its finest, and kind of let the individual states, governors, mayors, and local authorities and so on to kind of run the show and not try to run it out of D.C., which I think is wise.
How have you felt about your own state and your own government in Texas dealing with this?
I think sometimes it's been overly cautious. And again, I think I wonder sometimes if the leaders are just worried about making the wrong decision, looking bad in comparison to their neighbors, and regretting things, and as a result, they walk on eggshells. I don't know. It's a difficult position for them to be in, I realize, but there have been some draconian measures, and I think that's been not only in this state but elsewhere that have been challenging to deal with. I know we may visit about that later in the talk, but
how about this? In the president's press conference yesterday, it was stated that the number one industry leading the job loss is the healthcare industry. Now, you touched on that a little bit, like your work had diminished over the last month or so because some of the changes there. How is it possible in the midst of this pandemic that the healthcare industry is actually leading our nation in the job loss world?
It's the irony of ironies. I think that the public they're of course they're frightened. I think the media fuels that horribly with a lot of sensationalism. As a result, people are not going to see their doctors, and it starts at the primary care level. But that trickle down effect will affect someone like me, and especially like surgery, because if you don't go to your doctor about your gallbladder, your hernia, what have you, you're eventually not going to get to the surgeon to address the issue. So that doctors, not way beyond my specialty, same kind of thing. They're not seeing patients. Or if they are, they're being innovative, doing telemedicine and things that can help, but are certainly limited as far as good medical care. And as a result, my colleagues here at this very hospital talk about how they've cut back their hours, they've cut back their staff, they've cut back, just the number of days they even come to the office, and it's sobering. I think it's starting to slowly get better, but it's painfully slow.
Just to zero in for a second, you kind of noted this in passing, but in terms of like your own take on how serious the virus itself is, you noted that initially we didn't know what it was. You got these Imperial College data models, projecting maybe as millions of deaths, hundreds of thousands of deaths. It's been scaled back significantly since then. University of Washington had similar projections. Now we've got these antibody tests studies starting to come out, suggesting that it's the virus has been in the States for a lot longer than we originally thought. A lot more asymptomatic cases,
much more widespread.
The mortality rate seems to be dropping considerably. It seems to be particularly virulent and deadly, lethal for those over 65, but most under that. It's not a whole lot more deadly than a flu virus. What's your take on some of that?
That's a very good summary, and I will tell you that as more information comes in, I think that it is true. It's much more prevalent. The distinguishing feature is its level of contagion, and that's significant, particularly in a very heavily populated, tight communities. We obviously see it in New York City and other places, but
right.
But we see more and more that there are many asymptomatic carriers, and it's being confirmed by laboratory data. And this data is building day by day.
Yeah,
and it is changing the picture of what we're seeing. And meaning that I think you're right. I think it probably is more commonplace than we realize, and that. Hopefully we learn from it in the sense that quarantining the healthy just doesn't seem the best path, but certainly protecting our elderly and our immunocompromised patients is an important factor.
Sure.
And I think when we see in the elderly or people that have a lot of what we call comorbidities, a lot of associated illnesses,
yeah.
It's very complicated, and someone that has issues, diabetes or heart failure, heavy smokers, obesity. I think you've probably heard these over and over again.
Yeah.
It can make COVID much more a deadly problem, but it's multifactorial. It's not just COVID, and I think we need to remember that.
So with the risk that's out there that we see from COVID-19 and from the virus, and then what we see happening to hospitals, is there a way to balance that from your perspective where we don't have hospitals that are having to lay off so many people, and yet at the same time we're able to protect the people that need to see their doctors? Because you got a lot of people who probably would see their doctors, but they think, oh my goodness, I'm going to die going to go see my doctor.
You're exactly right. I think there is a lot of that fear, and I think by lifting, maybe not just suddenly, but gradually, the restrictions in the communities. Houston is seeing that happening. Businesses are starting to open slowly. That hopefully people will start venturing out and getting medical care that they need, because we can't just ignore congestive heart failure and diabetes and other issues that are just as significant. I just read on a surgical blog that I follow through the American College of Surgeons that they just surgeon just saw a patient with metastatic pancreatic cancer that was very delayed in diagnosis because of the COVID. It was tragic because things look pretty bleak from that regard. It's a good reminder to me, and I know it is to the medical community, that we've got other issues that just as much need dealing with, even though COVID's got the spotlight.
Yeah.
Love your neighbor.
Right, exactly.
Yeah,
yes, sir.
Yeah. So one question I had, you mentioned this, it reminded me when you were talking about the comorbidity factors. One of the questions we've asked a few different people as we've talked to them about this is we've seen reports that there's been pressure to report COVID deaths wherever it's sort of suspected. You've got people who have died from one thing, and then later autopsy confirms that they had COVID, and then that becomes the cause of death. Is that driving up the reported numbers?
I don't know the answer to that. I think, but I can see that could easily be happening. There might be. I don't know this, but I'll say that is there financial incentive to this kind of reporting? and does it reflect accurately though the medical environment that we're working in? I don't know the answer to that, but it's concerning.
Yeah.
Because the patients we do see dying, and we've had patient deaths here at this hospital from COVID, typically are either elderly or immunocompromised, or really have some associated conditions that are really contributing. And COVID's bad. When it hits the lungs, it makes for very difficult respiratory problems and challenges on a ventilator, and we see the dire results. But it's a very complex picture with a lot of things factoring in.
Have you had any pressure put on you to handle, in what you guys do at all? So there's a fallout effect from COVID-19 that doesn't have anything to do with COVID-19, like, for instance, churches. They've kind of had this whole different fallout too. Are you seeing anything kind of put pressure on you or a fallout from this in your area of expertise?
As far as the church is concerned, or as far as surgery?
Just surgery itself.
No, I think we're just being advised strongly and understandably to be cautious, to wear the gear, treat all patients as if they could potentially have the problem, face mask, protective equipment, and so on. And I want to do that. I don't want to be unwise, but I think there can be some overkill in this, and that, of course, everybody dons a mask. There's everywhere in the hospital, everybody's got a mask on, and we're washing our hands regularly. Just common sense kind of things.
Right.
I don't know what kind of impact that's going to have on turning this disease around. I have to wonder, but we're doing it, and we're complying, and it's maybe not submitting to governing authorities, but in a sense it is here at this hospital and throughout the city.
I shouldn't be surprised by this, but I am. Every state is doing some sort of draconian measure, except for like South Dakota, and if there's a few that haven't. In Texas, it seems like the state health board has given you guys some directives on this whole thing, and really kind of put some force behind it. What happened there with your state board?
There were actually three entities involved. The state board was the main one, the Texas State Medical Board. The governor, the lieutenant governor, came down at the initial outset of this, when we didn't really know what we were dealing with and how bad it was going to be, that to suspend all elective surgeries. What I admittedly took umbrage at was the threats if we didn't do it, ranging from licensure, suspension, to severe financial penalty, even to imprisonment. If anyone was quote unquote caught doing elective surgery. And I mean, we're professionals, and if we're asked to do something, we're going to do it. But there was so much threat. And I think if there was a hue and cry that I heard early on in the COVID crisis from the medical community, and particularly my colleagues, was just kind of the insulting nature of how that was presented to us.
Right.
And we got to have thick skin in all this, but it was kind of sad.
Right. So the state board threatened you guys if you did some sort of non-essential or elective surgery during this COVID crisis, that they would either fine you, imprison you, or take away your license. How does that work? How draconian is that for you, and how does that play out with your Hippocratic oath?
That's a good question. We certainly had lots of discussion among I'm on the medical executive committee at this hospital that I work at, and we had many discussions about how do we honor this, how do we honor the Hippocratic oath, how do we take care of people. And certainly the most expendable will be elective surgeries. Somebody can they've got a hernia, they can just hold on, and we'll get to it someday. But even if you're uncomfortable, but there are lots of gray areas that can crop up with patients. That a patient has gallbladder problem but doesn't have an acute infection, but they hurt every time they eat, and they're starting to lose weight. Is that still an elective procedure, or does that become a little more urgent?
Right.
So it took trusting our judgment to make that call, and not riling the higher ups about what they ask us to do.
But that puts you in a terrible place.
Well, and I'm trying to figure out, isn't the surgical room supposed to be the most sanitized, cleanest place that you could be at?
Yeah.
Well, it is, but I think the motivation behind the demands were to not use up COVID supplies, ventilators, PPE, staff, everything, and
it's the overcrowding thing.
But the irony is...
But look at everybody's off work.
Well, and the irony also is that those supplies weren't even close to being used up. We've got so many ventilators unused. People don't know what to do with them, and so we swung the pendulum to the other side for sure.
There was a temporary hospital actually built there in Houston that they're taking apart now because it was never even used.
It's like Seattle.
So, Dr. Ratliff, how do you move forward now with this? I mean, things are going to slowly get back to normal, but are you guys going to be able to ever repair the damage that was done in the process of this?
I think the process of repair is going to be very slow going. We keep thinking, once we open up the economy and once we tell patients we're ready for business, that doesn't mean it's going to happen. And I think that it's going to be a slow process, and we're still going to not have a whole lot to do at times, and that's challenging. We need to just be patient and persevere, but we'll get through it. I'm certain of that, and I'm thankful for what I do. I love what I do.
Yeah, and we're thankful for it too.
Yeah, I appreciate that.
Glad to have thoughtful Christian doctors thinking through these things and trying to do the best they can with a difficult situation. But I'm really concerned that there's going to be a lot of deaths
because of this.
Because of this, not COVID deaths.
No,
the pancreatic cancer deaths and the breast cancer deaths and the other things that didn't get treated
during this time
because we were focused on one thing.
Dr. Mike Ratliff, thank you for joining us on Cross Politic. More Cross Politic when we come back.
Classical Conversation supports homeschooling parents by cultivating the love of learning through a Christian worldview in fellowship with other families. We provide a classical, Christ-centered curriculum, local, like-minded communities across the United States and in several countries, and we train parents who are striving to be great classical educators in the home. For more information and to get connected, please visit our website at classicalconversations.com. Classical, Christian, get connected, get community.
There was a moment, and I think it was this week, where we introduced you, Gabe introduced you, and you pointed at all the cameras.
He's like this. I'm like, Pastor Toby, and you're like,
Just that's how you do it.
I pointed all my fans. All my fans. Hey, you're doing a good job over there playing with that music board.
I'm figuring it out.
Yeah, if you meet all the qualifications for stage 1, we'll move on to stage 2.
What's stage 2?
When we'll let you have a few more buttons.
Oh, I better hurry up and master this.
And then
I've been lazy during the quarantine. I should have mastered this by now.
We're doing 80% right now, and then we're going to go to 90% at stage 2.
Wait, I thought this was mine.
And you can do a real podcast. You can do a real podcast.
That's funny.
I thought I had control of this.
No,
I don't.
No,
all right. So Rebound Idaho
I don't like this.
came out this past week.
The rebound order.
Governor
you will rebound.
Yes, Governor Brad Little gets up and he's going to lay it out there for us.
I'm pleased to announce that due to the continued responsible actions of the people of Idaho to slow the spread of coronavirus, we have met the criteria to enter into stage 1 of our safe, responsible approach to reopening Idaho's economy.
I'm sorry, I was just watching the guy on the other side doing all the sign language. What did he say?
He's saying something completely different. You know the sound guy? He was like, and you can make popcorn.
He's saying everything he's saying is crack.
Blink twice. Help me.
I just want vitamin D. Can we please get past the whole coronavirus? That's all I was watching.
Oh my God!
All right, so we've been in this for 70 days.
Yeah.
He mentions. So Idaho's been in this for 70 days.
No, it hasn't been that long for the order.
But he's
isolation
talking.
order.
So he mentioned this in the press release later on. 70 days, but it's talking about from when the COVID started coming in Idaho. But the resolutions he
just wanted a biblical number. That's
was on. Yeah, exactly. Was on March 25th. Was his first resolution.
We've been going through this for 40 days and 40 nights,
and now we're in the 70th year.
But so
the 70th week.
So the stay home order is expired on
April 30th.
April 30th, and in its place on May 1st, he's implemented a stay safe order
called Rebound Idaho.
Rebound.
Can he do that?
Well,
legally,
stay safe.
I thought when we talked to
they make you wear your seatbelt.
That's true. But when we talked to Heather Scott, he was out of options.
Yeah, I don't know. So the thing is that it's ambiguous because he's appealed to the Idaho Constitution, which does allow him to declare martial law in states of emergency.
Oh my goodness.
Okay.
Yeah.
Now the problem, of course, is you have to, somebody sue him. First of all,
yes.
Did we have an attorney general like Daniel Cameron?
No, we don't have a Kentucky.
I looked up our attorney general after William Barr sent out his memo last week,
telling all the attorney
instructing
generals,
the 93 attorney generals across the country to check the orders and make sure they're constitutional and not infringing on constitutional rights.
There's 93 attorney generals.
That's what it said on the thing. I don't know.
How's the math work out there?
I don't want to know yet.
Maybe there's
maybe
some states
57 states.
97. There's 93 states. And so I looked him up, and on the very top of his page, I don't remember his name, but frequently asked questions. It says, "Is Governor Little's isolation order constitutional?" Yes.
That's it.
Huh.
Yes. Okay.
Can we just check and see if there's any deposits in his accounts or if he has an offshore account anywhere somewhere? I just want to know.
But the thing is, you have to demonstrate though, and this is what really needs to be pressed in the courts is emergency.
Yeah.
What's the emergency?
What is it?
What's the stats right now in Idaho?
Well, I think we have.
Well, we got 60 deaths in Idaho with a total of, I think, a little over 2,000 hospitalizations, around 2,000 hospitalizations.
Yeah. When we get done with this, I want to know when Governor Little is going to declare a state of emergency for the 1,300 babies that are murdered in Idaho every single year.
Exactly right. Yep.
Shots fired.
You can't say this is a state of emergency for 63 people that have died when 1,300 babies are slaughtered in their mother's wombs every single year in this state.
That's right. That is amen, Toby.
If you're going to do this, right? But I don't think this is a state of emergency with 63 people dying.
No.
But they're winning the argument.
That's because they had everybody at home, and like he said, he's proud of the people of Idaho for doing that.
Yeah, right. So that's the authority he's claiming. He's saying because in the Idaho Constitution, now this is something that the legislature needs to take care of.
Yes, they do.
Like yesterday.
Yes, they do.
Yeah.
They need
a mandate.
They need to get in there and they need to say no more of this crazy business.
Yeah.
You have to have some threshold, some standard by which to judge whether you have an emergency.
Yep.
And even then, there should be other checks and balances on this. Because this is insane.
I think like the Idaho legislature somehow needs to be worked into this where they need to approve his mandatory or his military grass fair.
I think right now he's allowed to do this for 60 days.
60 days.
I think before the legislature has to approve it.
All right. So he started on March 25th and he's got 60 days.
So I think he's just now working into a second 30 days. I think there should be a check where like maybe he could do a 10-day thing or a two-week max. But he's got to get more accountability.
Well, right now he's eased off some of the measures though, right? So he's allowed people to go back to work. So it's
not really. Restaurants still aren't allowed to go back until after 15 days, and you can't go inside restaurants. They can still do curb delivery. Gyms can't open up. I mean, it's not much different.
Nail salons.
For the first 2 weeks, it's not much different.
The thing that really bothers me about the nail salons and the restaurants is that the free market already has a fix for this.
Absolutely.
If you go to any place to get your car worked on, and when you go there, you drive off from getting your tires fixed, and they roll off your vehicle.
It's cleaner than when you left it.
Well, my point is that that car place can't stay in business if every car that they drive off there from there gets into an accident because the tires fall off.
That's exactly right. This is this kind of attempt at top down
doesn't work.
At regulating it all. It doesn't work. But the free market does.
Yeah, and
because if you know that people come into the restaurant, and then a COVID outbreak happens in your restaurant, guess what?
I ain't going to eat there.
You ain't getting any business for a while, right?
And actually, if your people come into work and they sneeze, they don't know how to hand wash their hands, and well, I ain't going there. But we already have a fix for that, so we don't need some sort of governmental overreach. And this goes back to what Pastor Kerry Gordon was talking about earlier this week. Like, you know what? I have a flock. I care for my flock more than these people do.
Yeah, that's true.
And I think you can extrapolate that all the way down to businesses. If we start harming our clients, they don't want to do business with us.
Right. And every business owner is in the best possible position to know how to take precautions, protect their business, protect their family, and protect their customers.
That's exactly
and
right.
if they care about their business and they care about their customers, they will do a good job. And if they don't,
they won't be in business, especially right now.
But here's what's bothering me: is we're losing the argument. We are losing the argument in all this.
What do you mean?
What do I mean? Well, they have the data on their side. They're saving people's lives. They have, the shelter in. Hey, look, our shelter in is working, everybody.
Yeah.
And
then this is actually the AP, the Associated Press, already has a story on the Idaho thing. And you're right, though. The narrative is basically Idaho is leading the nation in terms of the conservatives. In terms of conservatives, Idaho is leading the nation. Mm-hmm. He actually, in Brad Little's press conference on Thursday, he actually said that Mike Pence cited Idaho as sort of this,
as a great example, shining example.
And because as far as conservative states go, he's at the front of the line reopening, and so this seems like he's the beacon of freedom. Even though there's still a gun pointed at your head and says, if you open up your hair salon, you're in danger of being prosecuted.
What happened to South Dakota governor? What happened to Georgia governor?
Apparently, they don't want to talk about that.
You can't reference South Dakota.
These people are in South Dakota having a parade for her.
Yeah, that's right.
Let her. By the way, let her be great.
Right, but then you're absolutely right. The narrative, though, is they took these extreme measures, and then this is actually in the Associated Press story from Thursday. It says the measures worked. The measures worked.
It's unbelievable.
On Thursday, Idaho had 1,900 confirmed cases, at least 60 deaths due to the virus, according to a tally by Johns Hopkins University. The measures worked.
Well, we've lost the argument, and when you remember when we had Pastor Wilson on the show?
Yeah, that was a month ago.
April 4 weeks ago. April 1st. Pastor Wilson called it that Trump is going to own the Imperial College.
He's going to say it worked.
Yeah, because Trump saw the play.
Did all the right moves. I tell you, we wouldn't do. We were talking to Mike before. If we didn't do what we did, you would have had 1 million people die, maybe more, maybe 2 million people die. And if you think that we'd be at 65 or 70 or 60 or whatever the final number would be, 1 is too many. I always say it, 1 is far too many. This should have never been allowed to happen. Should have been stopped a long time ago before it ever got here or to other countries.
Man. So he just claimed. So the Imperial College obviously is the one that came out with the initial model that was not peer reviewed, as we already said.
Peer reviewed,
and the initial model came up with 2 million. Potentially, U.S. would lose 2 million. Would
with lockdowns. That's something that people don't catch.
It was with lockdowns.
Yeah, originally, they said with lockdowns, it might be as bad as 2 million, and then of course it just keeps dropping down.
Yeah,
and they keep sort of putting that into smaller and smaller footnotes because they don't really want to talk about the fact they got it so wrong. The dangerous thing about this, so first of all, kudos to Pastor Wilson. He's going to pivot. He's going to pivot, and he's going to say, fine, that's how many people would have died, and look how many I saved.
Look how I saved.
And this is a brilliant campaign. You know, I saved millions of lives. But what's insidious about this is that the logic of that, though, is that we would do it again.
Because
we would do it again. You know, take the scare tactic, the data model, that's the worst, and what do we need to do? Well, what worked? The measures worked. Shut it all down.
Shut down worked.
Take draconian measures. Martial law. Get your guns out.
We have created the template. Moving forward to how to deal with outbreaks.
Undercover cops. Posing to need to get their nails done.
And it's
and hauled off to prison.
That's what it's proved to me. I mean,
and no communion on Sunday
because they're God. The whole idea of people snitching has also revealed something for me. I thought that America wouldn't be like Auschwitz or Germany. And I think a lot of us had thought that as well.
Yeah.
But with everybody snitching on everybody else who's trying to live free and do their thing, live in America, it's proved that we actually have that exact same makeup. If the rubber meets the road.
That DNA is there.
If the rubber meets the road, we're going to have that same environment where we'll snitch on our neighbors. Are those Jews over there?
Right.
I think those are Jews over there.
But we're not nearly as bad as Germany, are we?
Well, we have abortion, so it seems like we're pretty close.
Yeah.
And you know, again,
and actually, Germany only killed like what?
6 million.
6 million, 8 million?
Yeah.
What are we at? 60 million?
60 million since
60 million.
1973.
Man, what does Jesus say about Sodom and Gomorrah? They're going to rise up, in this with this generation and judge them?
Yeah, that's right.
Germany's going to rise up and judge us.
Yeah.
And
that hurts.
You look at it, and I don't think we've been paying. I've talked about this before. We've seen a minority community come out and say, guys, police brutality, this or that, maybe a little overreach, just stopping us for driving while black. We've also, there's another angle on this. You have open air preachers who go out in front of now listen, they're killing babies in front of them inside of an abortion clinic.
Right.
Open air preachers come saying, we'll take your children, and they're getting arrested for trying to save lives.
Right.
They've been, that whole setup, that makeup that's there is a microcosm of what's going on right now.
Right.
And we have been missing.
It's the same insanity as the trannies doing library story hours.
That's right.
As if that's fine and normal.
And people,
tranny doing health department director of Pennsylvania.
That's right.
The fact that the police would be called on the open air preacher or that old lady out there who's begging for the life of that infant not to be killed, and that she would be getting arrested right now.
You're not social distancing. I mean, this is the height of Pharisaism, right? This is what Jesus said. I mean, Jesus said what Pharisees do is they pick out gnats and they swallow camels.
That's right.
Right. That's what they do. And you're not social distancing. Get away while we kill babies.
Yep. You could shop in this side of the store and not in this side of the store.
And it really is Pharisaism.
Yeah.
I mean, we're talking about cleanliness laws.
That's right.
Get your face mask on and virtue signal.
Yep.
Show me your holiness.
Hand sanitizer.
Holiness code, right? Follow all of this virtue signaling. You can't, and if they're getting into the business, you can't even have communion.
Yeah.
Right.
Well, it really is disturbing that we are basically creating the model for how the government's going to do it next time also.
Yeah. And Idaho's not immune to this. He's not quite as draconian and maybe as the county of Knox. What was it, Knox County or whatever it was called? Yeah. But even Governor Little has instructions for churches. Oh yeah.
What is he saying?
He says that he's got these kind of provisos. It's an order, and it's ordering you to consider things. You need to consider separate service times. You need to consider using signage. You need to consider directing the flow of traffic. You need to consider limiting the number of people in the service. Recommend worshipers refrain from hugging, handshaking, and other physical contact, including perhaps also canceling communion. You should consider canceling communion.
Well, California governor instructed people not to even sing because when you sing, it projects.
Oh, it wasn't because when you sing, the Holy Spirit fills you
because you're fighting.
We need some of them old time saints to be like, I don't care what they say. I'm gonna go ahead and worship Jesus anyhow. They ain't gonna come in here and tell me how to worship the Lord. I miss those kind of folks. I really do right now. I know I said not use wisdom, but again, I believe our elders, our pastors are the best people to be able to say we know how to keep our congregations healthy, and we don't need Governor Little telling us what to do.
But that takes gospel courage.
Come on now.
That takes the gospel. I mean, because I think what we're up against is craziness, insanity. Yep. I mean, this is no different. I said this in a news brief recently, which you can get at our app.
Which you should have.
Download that app. This is no different than meeting the crazy man in the tombs, cutting himself full of demons. Okay, that's America is the crazy man in the tombs full of demons.
Wow.
Right? That's America.
Yeah.
And he's naked and he's cutting himself and he's out of his mind.
Yep.
Okay? You don't reason with that man.
Yep.
There's nothing you can do.
Yep.
Jesus has to give him his mind back.
That's right.
Right? Jesus has to drive the demons out, and Jesus is the one who has to put him back clothed and in his right mind.
That's right.
The only
but don't forget, some of these only come out by prayer and fasting.
And that's the thing.
You know what I'm saying?
That's what we're up against.
And
that's why I said at the beginning of the show, America's dead. I mean, this is not us.
Yeah.
It's not like we're kind of dead. No, we're dead.
We need some resurrection.
And that's what you need: resurrection. You need regeneration. Amen. You can't come back from this kind of death apart from Jesus.
Amen. Come on now.
The dead, and that's the only way you'll have courage to face this with wisdom.
That's
Glory. Well, if you're a Fight Laugh Feast club member, we just want to thank you.
Amen.
May the Lord God
Thank you,
bless you
guys.
real good. And if you're not, you need to sign up and maybe get those blessings that are coming with it. All that content that's back there. But if you're single, get married. If you're married, have some kids. And if you have kids, go baptize them. So until next week, love God with all your heart, soul, mind, and strength. Love your neighbor as yourself. Go fight, laugh, and feast. Glory. This is Cross Politic.
You feeling it? You feeling it?
May God bless everybody.